Mountain Medical Emergency Alliance presents a look at community needs through injury prevention. Today, we wanted to discuss common injuries in our community and what we can do to prevent them. Our organization strives to offer the best possible care and protection it can for the residents of our community. Our area is rural and mountainous, which creates long and winding roads. These roads have been a site for many accidents. Our mountains give us beautiful rivers and rapids, which have also claimed many lives due to drowning. Our residents strive to provide our children with many athletic organizations and opportunities to play, but due to our terrain, transport times are usually high, and it takes longer to get to awaiting facilities. If we ensured proper education and training, we could minimize the need for transport. The first of these common injuries is motor vehicle incidents. Motor vehicle accidents affect everyone from rural to suburban to urban areas. But with our long and winding roads, with many blind spots and sharp turns, they affect us very often. In the United States, motor vehicle accidents are the leading cause of death of people between the ages of 1 year to 54 years old. They kill over 100 people daily. Many factors lead to injury and death due to motor vehicle accidents. Distracted driving killed 2,841 people in 2018. 12.6 million people admitted to driving under the influence of drugs or alcohol. In 2018, 636 children under the age of 12 died in motor vehicle accidents. In 2018, 2,500 teens between the ages of 13 to 19 were killed in motor vehicle accidents. 5,977 pedestrians were killed in 2017. In these graphs, we can see that males and those between the ages of 21 and 34 had the most fatalities in 2018, both with and without alcohol as a factor. About 87% of people, both nationally and in Virginia, reported that they always wear their seatbelts. If we want to lower the risk of injury and death in these accidents, we need to make changes and follow better guidelines. We should educate people on seatbelts and how to properly restrain their child in the vehicle. We should also be much stricter on our enforcement of DUIs and DWIs. We could also enforce blow-by vehicles for even first-time offenders. The public should be educated on safe driving techniques and how to avoid distractions, especially educating our young and our new drivers. Our speed limits should be heavily enforced, and we should always be educating the public more on pedestrian safety. In this graphic, we can see what type of safety restraint children should be in to ensure their safety. Children should be in rear-facing car seats from birth to age 4, but should be kept rear-facing as long as possible while still following the car seat height and weight restrictions. Children should be in a front-facing 5-point harness car seat from their graduation of rear-facing until they reach age 5, at the least. But they should not graduate to the next level until they are past the height and weight restrictions of their car seat. A booster seat should be used until the child can fit a seatbelt correctly. This is usually around 4 feet 9 inches tall, or around the ages of 9 to 12. Once the seatbelt fits the child properly without the booster seat, they can solely use the seatbelt. The lap belt should be on the upper thighs and not the stomach, and the shoulder belt should lay across the chest and not the neck. The second common injury is drowning. Drowning can happen to anyone, even the best swimmer. Our community lays among many beautiful lakes as well as many rapids. We should ensure proper education on life-saving tactics and swimming to ensure our community's safety. 3,536 people died in the years 2005 to 2014 from drowning. An additional 332 people die annually from boat-related drownings. Riptides, rapids, and strong currents are deadly. They can be avoided with proper education and awareness to the public. Many other factors also attribute to drowning deaths: lack of supervision, not using proper life-saving flotation devices, head injuries due to inappropriate diving, boating accidents, alcohol use, and the lack of swimming skills can also prove deadly. By bringing awareness and education to the community, we can avoid many deaths due to these factors. We can prevent many deaths by educating the public on what to do and what not to do when near the water. They should be educated on life jackets and proper fitting, learning how to swim, and ensuring that children and even adults have proper supervision and are not swimming alone. We can also advise or enforce that fencing is used around community and home swimming pools to ensure children, usually small children, cannot access this when not supervised. Trained lifeguards should be used whenever possible in any setting to ensure supervision and use life-saving skills when needed. The public should be educated on different dangers that are present in the water. Alcohol use should not be tolerated in any public swimming areas. Offshore life jackets provide the most buoyancy. They are able to be used in all waters, smooth and rough, and can turn an unconscious person right side up in the water. Near-shore buoyancy vests are used in calm waters where there is a better chance of a quick rescue. They can also turn an unconscious person face up in the water, but not as well as offshore life jackets. Flotation aids are used in calm waters where there is a good chance of a quick rescue. These will not turn a person face up. They are most commonly used for fishing and paddling. Inflatable life jackets are used in calm waters where there is a good chance of rescue. Once inflated, they will not turn a person face up. Throwable devices can be used anywhere. They are designed to be thrown to someone who is in the water and grasped until rescue. They should not be worn. This is not a replacement for a vest, but is used in addition to a vest. Special use devices can provide the same performance of an offshore, nearshore, or flotation aid device as marked on its label. These are usually work gear, sailing vests, and deck suits. Some can be a guard against hypothermia and cold water immersion. Finally, the last common injury we will talk about is sports injury. Sports are common ways that many children get hurt. There is usually the presence of throwing, kicking, tackling, cleats, bats, and plenty of other hazards. 2.6 million kids from ages 0 to 19 are treated annually in emergency department settings for sports-related injuries. Sports injuries commonly include concussion, broken bones, fractured bones, heat-related injuries, cuts, and bruises. Concussions are very common in the athletic community and can lead to lifelong issues if not treated properly. Many sports use concussion detection and very specific return to sports protocols. It is common for athletes to not be able to return to a field after a specific number of concussions, as it then becomes a traumatic brain injury. As we are in a rural, mountainous community, we strive to be able to provide sports organizations to our children. As children get hurt and require transport, we usually see a much longer transport time to a facility due to our location. In order to minimize the possibility of a transport, we must educate our community on prevention. Athletes should always wear the proper protection gear and ensure the proper use and fit. Protocols should be strictly followed before a player should return to the field after any injury. Players should take breaks, stay properly hydrated, and use sunscreen whenever necessary. Athletes, coaches, and spectators should always pay attention when there is action on the field. Coaches should be a good role model for athletes, enforce all safety rules, and always have a first aid kit on hand. This is how we can help our athletes thrive. We should help them have fun in their sport, help them feel comfortable telling their coaches they're having symptoms. We should help them have fun supporting their teammates if they're out due to a concussion. We should give them positive feedback and praise for reporting their symptoms. We should have parents who will talk with them about concussions and always model and expect safe play. And we should always have written instructions from healthcare providers on when we can return to school or play after an injury. When we provide education and prevention skills, we can provide more safety to the community while seeing injury and death due to these declining. Thank you. From Mountain Medical Emergency Alliance.